Well, it's Sunday and it's time for our regular catch-up with the Minister for Health and Social Care, David Ashford, who's joining us. David, we, as always, do the questions and answers in our next section, but this one is more open and a sort of general catch-up. I've got lots of things to ask you about health, but also about other things. So, first of all, I need to probably pick up on my question to you on the last press conference about the situation at Nobles Hospital and this Platinum committee that gets together. Maybe got more time to explain what's going on. You say it wasn't unusual to make requests to get extra staff from the UK in if needed. Can you give us more on that? I mean, we haven't got any flu, we haven't got any of the usual winter problems. So I'm kind of really into this. So we are under some pinch points up at the hospital. I think you've admitted that in the past, but stuff that is getting so serious we will have to bring in some staff from the UK?
Right, so what this is this is the Northwest Network. Now, the Isle of Man has always, for a long, long time, been part of that. And what happens is, and it happens within the northwest of England as well, is that groups in the northwest, of course, it would be hospital trusts. With us, we're basically the equivalent of one trust because we're one island, that get together that if they have any difficulties in staffing certain areas, they will provide mutual support. Now, when this current outbreak started, it went through the community quite rapidly, as we saw. And that meant that not just people who were infected with COVID, but we had a lot of people isolating. I think at its peak, it was nearly 3,000 people, I think was one of the figures I announced, if not just over. So, of course, that impacted on health and social care staff. So we had the conversations with the Northwest that in particular around critical care, because obviously that's where you much more need one-to-one care for a patient. If we did come under pressure in that area, would they be able to provide us with some resource? So we have looked at things like that before when we've been under winter pressures in previous years. We've never had to activate it to date, but it's a very sensible thing to have in place. And it's good that the Isle of Man is part of that network, because we have to remember that we are basically standalone. We have the one hospital, so it's a very important contingency to actually have in place that if necessary we can call on. This isn't unusual. We did this last year as well, because of course last year it was a brand new virus at that point. We didn't have any idea where it could go. We didn't know if our trajectory was going to go the same way as what we saw in Italy. So we had conversations then as well around what support the Northwest regional network could actually provide us. So this is absolutely no different. My understanding is to date we haven't had to call on it. And things are slowly starting to ease now as people come out of isolation and come back into work. But obviously it has been a touch and go, and we've said that all along, because we've got to go back again to the two principles of why we do take the action we do around COVID. And the two principles were preservation of life and also preserving the NHS to make sure it wasn't overwhelmed. And so it's absolutely important we have mitigation measures in place.
So following that question, it appeared on Twitter and other places that in fact there were people from across already over here. That isn't true then?
There's always been people who come over, so there is doctors and so on. We also use agency staff. Now, agency staff is slightly different. Agency staff have always tended to come from the UK in the majority of cases. There are some agency staff that are based on Ireland, and that continues to be the case. That's not outside of the norm that agency staff from the UK would come into the island. We do that in normal times.
Okay. Now, when you release the figures and you go on the press conferences, would it not make sense to actually just say from the get-go there is one unexplained case in the community? Because you do the very rightly so the numbers, but you don't give us that information almost until we all have to process that thing. Wouldn't it make sense to have that listed?
It would do, but sometimes you've got to remember I'm normally preparing for the press conference at around about 3:45 before it starts. In some cases, ahead of that figures being published just after 4, it's still being verified. Because it's a manual process to verify unexplained cases. And in fact, it's a very good point, because one of the things people spotted is the figures changed last week. And the reason being on contact tracing can be ongoing and there can be a missing link. So something might look unexplained, but then a few days later, someone actually presents symptomatic who links that other case back with something else. So it's a bit like a jigsaw puzzle. The pieces don't necessarily always go in the same order. So while it is good information to have out there, it's not information I always do have to hand at the first point when I appear at the podium. And it is important that if we're trying to get something like that out, that it can be. So I will sometimes get it while I'm actually on the podium. People will see me with my iPad, and that's one of the reasons I always have the iPad, because I can even be receiving information through while I'm actually there, stood there.
Because you understand this is the headline figure we're all going to be living under, wanting to make sure there are 0 cases in the unexplained section.
It is, because that's what everyone's praying for, to be quite frank, is to have days of unexplained cases. And that's why as soon as we've got that confirmed figure, that goes out. But it's got to remember, I don't prepare for the press conference with 60 seconds to go. I normally get the stuff around about half an hour before. Sometimes there can still be verification going on. Normally, if we have got it, it will normally go into the Chief Minister's speech rather than into my figures to say we've had X amount of days of unexplained cases. But also what we don't want to do is turn around and say there isn't any unexplained, and then it turns out that because contact tracing's ongoing, that actually there is.
You're going to be more precise about people who sadly die from COVID or of COVID. Can you explain more about that?
Yeah, so obviously, tragically, we have had another death up at Nobles with someone who was with COVID. Now, this becomes very, very technical, and if people go online, they will find all sorts of articles around this. There is, the easiest way to explain it is someone with COVID means that they were suffering from COVID-19, but that wasn't actually what caused their death. They may have other conditions that even without the COVID might have actually led to them dying, and that won't be what's caused, listed as the primary cause of death. Dying of COVID means that COVID is the primary cause of death, and sadly that person has died from.
Are you going to go back and re-evaluate all the figures?
I have asked for that to be done. We're not going to re-evaluate the figure because the overall figure that we actually publish is both with and of. But I think from a transparency point of view, it's very important that we do split that off. So we did actually say as part of the press release that went out that we would retrospectively go back and re-evaluate each one so that people can see that very, very clear delineation on the dashboard. And
just also pick up my other question the other day about this thing about if people are on the ventilators, they seem to be suffering much more than they were last time. This is a stronger variant that we all know, but is it taking its toll on people who really are susceptible to COVID, and if they end up in the ICU and on ventilators? Well, actually, that doesn't seem to be the case, actually, in terms of when you consider the number of cases we've actually had in this outbreak compared to the number who've ended up in ICU. And when you look at the number of cases we had last year with the old variant, that doesn't quite stack up. I mean, every patient is individual. It's one of the problems with the virus. It will affect us all differently. And tragically, some people get very, very much badly affected than others. But there doesn't seem to be any evidence, certainly at this time, that it's any more virulent, it's causing any more serious illness than the old variant did. So pressure-wise, it's the same as you've already said. You're coping, you're doing all right, but you're still under pressure. Yeah. The risk with the Kent variant is the fact of the transmission rate, the fact that it is more transmittable. So more people, if you have a widespread outbreak, are going to contract it. And of course, if you've got more people contracting it, the law of averages is you will actually have more people who will get seriously ill in terms of numbers because you've got a higher proportion of people contracting the virus in the first place. So that's where the actual risk comes with the Kent variant. Well, it's been a couple of weeks. I keep asking this question. I know you're still looking for the answer. Your manning levels on the COVID 111 line, although I understand it's probably fine now because everyone's booking online, right? But did you ever get your answer? Because somebody that I'm still chasing it. What? Paul. I am still chasing it. I'm following it up. Like I say, it's not within DHSC. It won't matter soon. It won't matter. I do promise you. Well, whether it matters or not, I think it's a very important figure for people to see. Right. So as soon as I have that information, we've got a press conference hopefully tomorrow. Who knows? Miracles may happen, and I may have that data. But I did promise I would share it with you, and the moment I have it, it will be out there, because even if it doesn't have particular relevance anymore because the levels have returned to normal, I think it is nice for people to know what the response was and how it's geared up. Okay, I'm going to usurp a question that's almost certainly going to come up tomorrow in another form maybe, but Dr. Rachel Glover is going to give her account to the Public Accounts Committee. Juan Watson announced that with me the other day. Are you worried, sweating, concerned what's going to come out? No, not at all, Paul. I mean, Rachel, as I've said, is a very good scientist. She's very, very good at what she does. I think it'll be a very interesting session on genomics with the Public Accounts Committee. That's what the Public Accounts Committee is there for. They are there to scrutinise government and to take evidence from both
sources within government and sources without, and then draw conclusions that come before Tynwald. That's the same as any other process. And like I say, Rachel's very good in the field at what she does. She gave an excellent presentation to genomics to Tynwald, and I'm sure she'll give an excellent session to the Public Accounts Committee.
One more just on the health before we move on. The group level letters, for the different ages, have they all been sorted now? Because we keep hearing about the blips and things, and that has come up from time to time. Is it now better organised? No, that's not the right word. I mean, people slim through the net, we understand that. But do you think everyone's been sorted now?
Well, we need to be clear what the issue was. The issue wasn't with the age group letters. The issue was with those who fell into the vulnerable categories, because that was a manual process. That meant the GPs going through and actually having to look at their patient records and discerning who suffered from a condition that made them vulnerable to COVID. The actual age group letters are purely generated off date of birth on the primary care system, so there should be no issue with them because it's literally linked to your date of birth. So unless your date of birth is wrong on your medical records, then that shouldn't cause any issue at all.
Well, I know I was telling you off air before we went on the press conference that I was getting mine on Friday. I just thought I'd let you give some feedback. It went extremely well down at Chester Street. It was a very slick organisation, and the operation itself of the jab was brilliantly done, in and out, as I think everyone's saying, within 10 minutes. Was interesting though, I got the side effects, which is a bit annoying because I thought after 9 hours after the jab I was okay, but I did go down into the sort of flu shivery mode and the classic hangover feel next day. That seems quite common.
Yeah, it is, and it's common with most vaccines because the whole point of the vaccine is it's triggering your body's immune system to actually fight it off, to teach your body to fight off that particular illness. So it is normal that people will have that sort of reaction. It can be delayed for a day or even 2 days after the initial jab. I know the team will be delighted to hear that feedback, Paul, because I've got to say they've all been working exceptionally hard, both at the airport hub and the Chester Street hub, to make sure that it's an efficient and slick operation. I've had lots of feedback from people who've said exactly what you've said, that it was a very smooth operation. I'd just like to thank the staff for everything they're doing, because they've never had to do anything like this before, and I think they've really pulled it out of the hat to make sure that it works.
And my top tip is have some paracetamols in, because there was a queue at the chemist afterwards because everyone was given the advice to take some paracetamols if needed. And of course, it's something you might not have in. But anyway, there you go. The chemists are doing quite good business out of that part of it. I want to ask you about Manx Care now. This is the big week coming up, isn't it? 1st of April, isn't it? Manx Care?
It is indeed, 1st of April. The World of Healthcare changes. As I've said before, this isn't the end of it. This is this is only the beginning, really. Manx Care launching is the start. There's huge amounts of challenges across the whole healthcare sector, but the split of services and policy, making the department focus on policy, which is what it should be doing, and allowing Manx Care to get on with operational delivery is absolutely key. It was supported unanimously through Tynwald, the Sir Jonathan Michael Review, as was the Manx Care Act as it is now, and we're looking forward to a brave new world on the 1st of April.
I tell you, I get slightly worried when I think about that, only in the sense of it'll be arm's length. That great quote we always hear about, it's nothing to do with us anymore, it's theirs. It's all like the steam packet with the government. And how many times have you, when I've raised this whole thing, you've gone, it's not directly to do with us, it's arm's length?
Well, that's slightly different because the steam packet is a private company. Manx Care is not a private company. Manx Care is generally a statutory board, but it has slight differences to other statutory boards, so it is more arm's length. The actual limitations around that, so the department still has oversight. As Minister for Health and Social Care, I am still ultimately responsible for everything that goes on in the services, and I will be answerable to Tynwald on that. That hasn't changed. What has changed is that we lay down a mandate as the department, so we instruct what Manx Care needs to look at, what services they need to deliver, but it's the how those services that are delivered that sits with Manx Care, and it's all laid out in law in the Manx Care Act, where the limitations of the powers between both the department and Manx Care sit.
So the buck still stops with you?
So ultimately the buck still stops with me. This isn't an excuse for me as Minister to say that's no longer to do with me, that's Manx Care. Ultimately I still hold the responsibility for health and social care on the island, the political responsibility. Now,
before we finish this section, as always, we can move out into other directions. I want to talk about the Prom. I would love to interview the minister, but he's gone AWOL completely. I cannot get him to get an interview in the can. I don't think he's done anything else anywhere, which is a shame, because he always said when he took the job on he would be available for interview whenever. So really down to you, the promenade and horse trams, we can put those into one really. Disappointment that from so many members of Tynwald that the horse trams thing isn't going to be sorted out, and the money, where's it going to, and all that. Anything you can add to this?
Well, in relation to the horse trams, I mean, I've got pre-declared positions on that, because I spoke very lengthily on it in Tynwald when this all came forward. I'm one of those members that wants it to run the full length of the prom. I've always been a strong supporter of the horse trams, and I think that I think if we're going to have it, it needs to run the full length. But equally, I can understand with DOI at the moment, because they've been disrupted so much, the pressure is getting the prom finished. And if we go back to that Tynwald debate initially, the thing from DOI was get the prom finished, then look to extend. Now, I think at the moment with the disruption, the key thing is to get the promenade done. There is people suffering down there. I don't represent the promenade now because I'm Douglas North, but back when I was on Douglas Council that has different ward boundaries, I did represent the promenade area. And I know that there's a lot of businesses down there who've had severe disruption now for a long time. And so the key thing has just got to be to get the promenade itself finished and open. And then if we need to come back and revisit the horse tram track, then that's what needs to be done. But the key thing from me is I'm still a supporter that it goes the full length. That is what, the Tynwald vote is there. And I'm sure that DOI will honour its promises in those regards.
But it's going to be left to the next Tynwald, isn't it? By the looks of it now, it's all going too late.
Well, it will probably be in the next administration, because realistically, with the added disruption that wasn't expected to the promenade this year with further lockdowns, that has resulted in the timescale being pushed out. But from my point of view, the key thing is, rather than us arguing about the horse trams, and like I say, my personal position is perfectly clear, it should run the full length. I think the important thing is that roadway, getting the prom open, because it is a major thoroughfare. And whichever way you look at it, you don't actually, it's always with these roadworks, you don't realise how important certain stretches are until they actually shut down and the disruption it causes. And the promenade has caused traffic disruption, it's caused disruption to businesses down there, and the key focus has got to be on getting that roadway fixed and opened so that that disruption comes to an end.
You see, you had an answer there. Maybe if Tim Baker can look at his text messages for me and get back to us, I would appreciate that. Before we finish this section, questions in Tynwald and House of Keys. It came up again this week, particularly that you as Coman got through 3 questions, then you blocked any extension. Your views on that?
Well, the first thing I've got to say is it's not just councillor ministers. If you look at the votes, there's other members that also
there was one, wasn't there? That's Chris Robert-Shaw, wasn't it?
There's one, but there's on other occasions, I'm talking about other occasions as well, you will find that other members do. The purpose of the House of Keys is legislation. That is the primary purpose of that branch. Now, questions are exceptionally important because they hold the executive to account. As a minister, I'm probably not supposed to enjoy question time, but I do actually like question time. And there's been many occasions where councillor ministers have actually voted to extend questions where there's only a few questions left. But when you get through 3 questions in the space of an hour, and there's 12 questions on the order paper, as it stood, we reached the end of the session without getting through the order paper. We had some very important legislation on there. For instance, the Landlord Act bill that's going through at the moment that requires quite a heavy amount of scrutiny. That's been held over to the next sitting, quite rightly, because people wanted more scrutiny on it. But we actually, if question time spent takes up 4 or 5 hours of the Keys sitting, then we are losing time on doing what the branch is actually there for, which is consideration of legislation. Now, that might not be as exciting for many people outside, because I know the general public like question time, and like I say, question time is important, but it should not affect the primary purpose of the branch. And in fact, I've done a quick calculation, and I've actually gone back through, and I think, certainly on my records, unless anyone can correct me, and maybe I've miscalculated, but this council of ministers has actually voted more times to extend questions than any previous council of ministers. Okay,
you've always got an answer. Well done. Someone will now go checking that one back. Before we finish, I want to ask you about the lockdown, the feeling you're getting back, in the community on how people are dealing with it. I mean, you get hundreds of emails an hour. What's the general feeling out there now?
I do, and people are struggling. To be perfectly frank, there's a lot of people struggling. It feels like Groundhog Day for a lot of people, Paul, and we do recognise that. This is one of the reasons we brought the bubble effect in. But there's also been people out there forming their own groups for support within the community, which has been lovely. I know on social media, sometimes we get critical of social media, but there's also some good things. There's been groups formed on there. In fact, one of the groups that's formed is actually the Ladies in Lockdown, I believe, on Facebook. Now, I haven't actually seen it myself, but I have been told that they've even been keeping themselves amused by trying to guess what books are on the bookshelf behind me. I hate to disappoint one that I've been told, and I can unfortunately tell them there is no 50 Shades of Grey, which I believe they were thinking was there. I think if they actually do read the titles behind me, I think they'll be very, very disappointed because they're actually probably quite boring for most people. But people have come together to form these groups and to provide support for one another. And as a community, I don't think we could ask for more than that. We've pulled through this before as a community, and we'll pull through it again.
Well, we've got a question and answer session coming up next, so look out for that as we continue talking with the Minister for Health and Social Care.